A really powerful new kind of intelligence is starting to show up in one of the most personal places imaginable, the doctor's office. It's promising a revolution in how we do healthcare, but it's also forcing us to ask some really big questions about the future of medicine itself. So let's just dive right in. We're going to start not with some fancy new algorithm, but with a number. Just a simple number, 2.5. And this number, well, it represents a very, very human problem at the absolute heart of medicine today. A problem that is fueling a massive technological gold rush. Yeah, you heard that right. 2.5 hours. That is the average amount of time doctors spend every single week on paperwork after their day is supposed to be over. It's called pajama time. It's a huge reason for burnout, and it's happening in a system that's just drowning in admin tasks. And it's this exact problem that big tech is racing to solve. So this is where a new player enters the scene. And look, this isn't just another app or a slightly smarter search bar. We're talking about something fundamentally different, something that promises to be an active participant in your care. This is the AI agent. Now, what's so wild about this is the huge distinction it makes. We're all getting used to AI that informs us, right? It gives us answers. But this is different. This is an AI that can act for us. It's designed to be a collaborator, something that can carry out complex, multi-step goals, all with a certain amount of autonomy. And this chart, man, it just perfectly shows the leap we're talking about. Think of it like this. A normal large language model, like ChatGPT, it's an incredible research assistant. It can answer your questions, it can write things for you. But an agentic AI, it can actually do things. It can execute tasks, coordinate entire workflows, even talk to other digital tools to get a job done. It's really the difference between having a consultant and having a new member on your team. Okay, so what does this actually look like in the real world? All across the healthcare industry, these AI agents are already being put to work in very specific and pretty different roles on this brand new kind of medical team. The big vision here is to create this, totally seamless system. For the doctors and nurses, you've got AI co-pilots that can listen to a conversation and draft the clinical notes automatically, which takes direct aim at that pajama time problem. Then for patients, like us, you get a personal health agent on your phone for 24/7 guidance. And for the administrators, these agents can automate the crazy complex worlds of billing and scheduling. And of course, you've got the tech giants like Amazon building out this whole vision. They're not just making one tool, they're creating a whole suite of them for both sides of the coin. A personal health agent for you, the patient, and a super powerful admin platform for the providers that can handle everything from scheduling appointments to medical coding. At the same time, you have the established healthcare software companies like Epic, who are building these agents directly into the electronic health record systems that millions of us already use every day. They've even given them names. Art helps doctors make sense of complicated patient charts. Emmy acts like a digital guide for patients. And Penny helps the staff fight through that maze of insurance and billing. And you know what? Patients are absolutely taking notice. According to data from Forrester, people are getting way more interested in using AI for their own health. Just look at this chart. Among Gen Z and millennials, interest shot up from 26% to 39% in just 1 year. People clearly want tools that give them more control and a better understanding of their own health. But, and this is a really big but, this is where the story starts to get a lot more complicated, because while this technology promises to solve these huge problems of efficiency and access, it's also raising some profound new questions about what healthcare even is. Which leads us to the critical question, right? In our rush to make medicine faster, cheaper, and easier, are we in danger of fundamentally changing the moral fabric of healthcare itself? And researchers in this field are basically waving a huge flag saying, hey, hold on a second. They're talking about something they call techno-moral change. As this quote says, the goal is to think about how this tech could reshape our deepest medical values before it's completely wired into the system, not after the fact. And here's the vision, spelled out perfectly by Amazon's Chief Technology Officer for Health Services. The promise is incredible. A powerful, truly personal, always available health companion in your pocket. It's a very compelling pitch. But then here's the flip side. Here's the word of caution from ethicists. For centuries, the absolute core of medicine has been the relationship between two people, the person seeking help and the person providing it. Introducing a powerful AI as a third partner in that room fundamentally changes everything. It could transform that relationship, and as this paper warns, maybe even diminish the human connection at its very heart.
And all of this leads to a brand new set of really complex trade-offs. I mean, think about it. If a network of these AI agents makes a mistake, who's actually accountable? To get the most benefit out of this, how much of our privacy are we expected to just hand over? If doctors start relying too much on AI, do their own critical skills start to fade away? And maybe the most fascinating one, early studies suggest some people are actually more comfortable telling sensitive things to an AI than to a human doctor. What in the world does that mean for the future of trust in medicine?
So, where does all of this leave us? We are standing at a really critical moment, literally watching a new chapter in the history of medicine get written in real time. On the one hand, the promise is just immense. There is a full-on race to build what some people are calling medical superintelligence, a future where AI finally lifts that crushing administrative weight off of clinicians and gives us, as patients, incredible new tools to manage our own health. But the ultimate question still remains, and it's a question we all have a stake in. As this powerful new teammate joins us in the exam room and our most vulnerable moments, how do we make sure that in this huge quest for efficiency, we don't lose the very human heart of medicine? That is the challenge we're all facing.